Hey guys, welcome back to All on Law. This is a quick internal medicine, and today I'm gonna talk about a EKG topic. Um, that's Today I'm gonna talk about what you call tachycardias. I just want to say that EKG is really very important topic, very important what you call topic for your USMLE examination. Okay, guys, so try to concentrate on this. So let's talk about how to proceed with the patients with the tachycardia. Okay, you know very well, in a previous video we learned how to calculate the heart rate. Let me revise you guys. The heart rate indicates a ventricular rate, right? So that indicates the patient's pulse rate, right? So the QRS complex of the EKG shows what you call ventricular depolarization, or what you call ventricular rate. So that's why we calculate the heart rate by using QRS complexes. We have two formulas. One, if the rhythm is normal, then what you call we measure the heart rate as 300 or by number of large squares between two what you call QRS complexes. And if it's a what you call the rhythm is what you call irregular, then we take QRS complexes in a 30 large squares and we multiply by 10 to make it for a 1 minute, right guys? So just watch that video, you will get an idea. Now we came to know that if the heart rate, if it shows more than 100, then we call it as a tachycardia. That's the question, right? So if the heart rate is more than 110, then we call it as tachycardia. If it's below 60, then we call it as a bradycardia. And if it lies between 60 to 100, then it's called as a sinus rhythm, normal rhythm, right? Normal heart rate. So let's talk about the tachycardia. First, always remember, if the heart rate is more than 100 and that's a tachycardia, then you have to check what you call the rhythm of the patient, the cardiac rhythm. The next best thing is check the cardiac rhythm. Okay, guys. So you know the cardiac rhythm, the sinus rhythm is also known as the normal cardiac rhythm, in which what you call the heart rate is between what you call 60 to 100, right? And the P wave is what you call upright. The P wave is upright in a lead 2, okay, in a lead 2, and the P wave is what you call inverted in AVR, okay. So this is really very important. The P wave is upright in lead 2, if P wave, and P wave should be what you call inverted in AVR. And the other thing is the P wave should be followed by what you call QRS complex, should follow the QRS complex. So after P wave there should be a QRS complex. Means if these things are present, then we call it as a cardiac rhythm is normal. Okay, so after checking the rhythm, then what you have to do is check whether what are the signs of the QRS complex. Means if the tachycardia patients confirm it, heart rate, check the rhythm, you check the cardiac rhythm, let me write CR, cardiac rhythm, then what you have to do, look at the QRS complexes. If the QRS complexes can be either two types. One, it can be less than 3 small squares, okay, small squares, or it can be what you call more than 3 small squares. Okay, if it's a less than 3 small squares, we call it as narrow QRS complex. And if it's more than 3 small squares, remember it's a small square, not the last square, okay guys? So it's going to call it as a broad, what you call the QRS complexes. So narrow QRS complexes always what you call arise from above the ventricle. That's why it's known as supraventricular tachycardias. Very important. Narrow complex QRS complexes is due to what you call the origin of this tachycardia above the ventricle. The cause is above the ventricles. So it's gonna be, for example, like sinus tachycardia, atrial tachycardia, atrial flutter, atrial fibrillation, and AV re-entry tachycardia. Okay, so this is really very important. Look at the narrow complex. If there's a narrow complex, then causes for the narrow complex is the cause is just above the ventricles. So what is there above the ventricle? It's a atria, it's a node, it's a right. So we call it the sinus tachycardia, atrioventricular atrial tachycardia, atrial flutter, atrial fibrillation, okay, AV re-entry tachycardias, right guys? So this is really very important, okay. And the what you call broad QRS complexes, that is more than 3 small squares, can occur if normal electrical impulses are conducted abnormally or aberrantly to the ventricles. Means this delays ventricular activation, so the widening of the QRS complexes. So any of the supraventricular tachycardias, as we discussed in the narrow QRS complexes, okay, as we discussed in the narrow QRS complexes over here, can also be present with the broad complex tachycardias if the aberrant conduction is present. That's why. So it doesn't mean that the what you call supraventricular tachycardia doesn't give a broad complex. They can give, but if there's a aberrant conduction is present, then they can give broad complex tachycardias. Okay, guys. So very important point. So broad complex tachycardias should also make you think of some ventricular arrhythmias. They are really very fatal, like ventricular tachycardia, VTAC. Okay, we uploaded a video on that. Try to watch that video. That's really very important, and you will come to know a lot many information on that. Okay, then we have a torsades. Okay, then we have what you call accelerated idioventricular rhythm. So these could be the causes for what you call broad complex tachycardia. So you know very well, guys, how to calculate what you call if the patient has a tachycardia, how to proceed with this. Look at this rhythm. If the rhythm is what you call, look at the rhythm, okay, and then check for QRS complexes. If they are narrow or broad, narrow it means less than 3 small squares, broad means more than 3 small squares. Narrow complexes, what is the cause? The cause is above the ventricles, like sinus tachycardia, atrial flutter, atrial fibrillation, and AV re-entry tachycardias. Okay, guys. So broad are what you call more than 3 small squares. Okay, and these occurs if there is a what you call electrical normal electrical impulses are conducted abnormally or aberrantly to the ventricles, and this what you call delay this delays what you call ventricular activation and widening the QRS complexes. So any of the what you call, as I said, any of the supraventricular tachycardias can present as a broad complex tachycardias if there is a aberrant conduction is present. That's really very important. And what are the causes for broad complex tachycardia? Ventricular tachycardias. Then we have what you call torsades, right? And accelerated idioventricular rhythm. So this is regarding the basic what you call video, small video on if there's a patient has what you call tachycardia, how to proceed with this. Okay, guys. So thank you so much for watching this video. Take care.